Okay. Good afternoon, everyone, and welcome to the PCAL webinar for the Research in Nursing and Midwifery Guided Review of Nominated Literature Assessment. My name is Suzanne D'Souza. I'm one of the PCAL tutors on the Parramatta campus. To support you with this assessment, we have with us today your unit coordinator, Dr. Shija Patros. Hi, Shija. Welcome.
Thank you, Susan. So, yeah, let's start with the... And we had a bit of delay, so maybe we will not wait for long.
Yeah. And we also have with us your Deputy Unit Coordinator, Rona Pillai. Welcome, Rona.
Thank you. Hi, everyone. Hope you're enjoying the unit.
Okay. We also have with us today a few PCAL tutors. Marian Martin from the Campbelltown campus.
Hi, everyone.
Welcome, Marian. And Johnny Wells, who is the PCAL tutor at the Liverpool campus. There you are.
Hi, everyone.
Hi, Johnny. Right. Now, the purpose of this webinar is to focus on the requirements of the guided review of nominated literature assessment. This webinar is being recorded and will be posted onto your view site. Okay, before we launch into this webinar, just let me briefly touch on how you can maximize the webinar experience. We want this to be a very interactive webinar. How do we do this? Now you can see us, you can hear us, but when we ask you a question, you can't actually verbally respond to us. So you might need to type your responses in the chat box. Can I now get you to locate the chat box and respond to my question? Okay, you need to find the chat box and reply. Okay, thank you, Binju. It is 1,500 words. So we will be monitoring the chat box and we will respond to your questions. Apart from this, from time to time, we might also need to check your comprehension. So could you please click on the raise your hand button, please? All right, there we go. Excellent. I think we're now all ready to get started. Okay. Now, before we actually get into this assessment, please remember the PowerPoint that we're going to view today has been put through Turnitin. So copying any information from the PowerPoint is plagiarism. We will be showing you some sample responses, but they are to be used as a guide only. You need to come up with your own answer. We might skip a few of the initial slides and start with this slide. Why do we need to review nominated literature? Students, most of the time they ask me, why do I need to do research? Why do I need to review literature? That's because as nurses, you might need to engage in research. And even if you don't engage in research, you might be asked to evaluate the worth of research already reported. Identify strengths and weaknesses of the published research. Decide on its applicability to clinical practice. Make changes to patient care management if required. So nursing practice is guided by research, and therefore it's very important to learn the principles that underpin research. These are the different parts of the research paper. I thought it's good to introduce you to the different parts of the paper because you're going to be looking at two different articles and trying to review them, locate answers. So abstract, introduction, methods, results, findings, discussion, conclusion. Okay. Are you able to view the Midwifery article, Rona?
Yep.
Okay. Just quickly skimming through the article, as you can see, it begins with an abstract. That's the first part. And then we have the introduction to the article. setting the topic in context. Then we have the background. Sometimes it's divided into two, introduction, background. Sometimes the background is embedded within the introduction. Then you have the methods with different side headings. So under the methods is where you'll find participant selection, data collection, analysis, etc. And then come the results, the findings if it's qualitative study. And then a discussion section. And a conclusion section. All right, so it's important to know the different parts of the research paper so that you can go straight to that section when you locate your answers. Also, let's briefly review some common terminology in research. So can I get you to match the left-hand side terms with the meaning, which is on the right? Very quickly. Understanding the meaning of these key research terms will help you a lot with your assignment. Let's see if you came up with these answers. So subjects are the participants in the study. Data is the information or facts collected. Sample, the population tested. Aim is the purpose of the research. Inclusion criteria. This is an important term which you will be using in your assignment. That's the characteristics that subjects need to have to participate in the study. Exclusion criteria, characteristics that disqualify subjects from inclusion in the study. And variables are concepts, characteristics, or traits that vary or major differences. Okay, in which section of the research paper do we find the aim? Can you type in the chat box, please? We showed you the different parts of the research paper. Where's the aim? Top. What do you mean by top? Which part is it? We learned some. That's right, Heidi. So it's the abstract. Okay, so the aim is in the abstract. Where else would the aim be? Where else would it be? In the introduction. So the aim is in the introduction. The abstract contains all the different parts of the paper. But when you're looking for the aim, I would recommend that you go to the introduction and take the aim, because sometimes the abstract, it's real brief information. You get a more detailed aim in the introduction. So it's best to go to the introduction. Where would you find recommendations? Could you please type in the chat box? Everybody is thinking, this is a bit of a difficult one, isn't it? Where would we find recommendations? In the results findings. Now I'm going to check with Shija, because as you all know, I'm not a nursing tutor, so I cannot touch on content. We have two different answers. We have results, findings, and conclusion. Which is the right answer, Shija? Could you please highlight?
Yeah, you may not have a straight answer to this. Mostly it's not in the findings. It will either be in the discussion or in the conclusion. So you generally don't find the recommendations in the under the heading of results or findings.
Thanks, Shija. So that's a clue for you, everyone. If you're looking for recommendations, and yes, in this assessment, you need to find the recommendations outlined in the article. Don't look in the results or findings. Go straight to either the discussion or the conclusion. Now, the rest of the stuff, research design, participant recruitment, inclusion, exclusion criteria, data collection, findings or results, and data analysis. All of them, you can find them in which section? Can you type in the chat box, please? In the methods section, that's right. So it's very important to know which section contains what type of information. That way you will save time you'll go to the right section and find the right answers. Okay. And that's the answers we just talked about. Before you start your assignment, please make sure you read your articles. Okay? So what do you need to do? For this particular assignment, you're provided with 2 research articles. One based on a research study using a quantitative method and the other using a qualitative method. Read both articles available on your view site and answer the set questions in the template provided. So let's take a look at your view site. Are we all able to view the view site? Rona, Shija? Okay.
Yeah.
So this is your view site. Let's go to assessment 2. And here it is. If you're a nursing student, here's journal article 1, which is based on a qualitative study. We're not going to open that now. And that there's a quantitative article or an article based on a quantitative study. You need to use both articles. Okay, you're reviewing both articles. I repeat, not just one article, you need to review both articles. And there's a set template provided. Are we all viewing the template, ladies?
Yes.
All right. So you need to type in your answers in this particular template. Okay. So I repeat, everyone, please use the template. Qualitative study. So this is the article. So type in your responses to the qualitative study this side, and the other side is the quantitative study. If you're a midwifery student, here are your articles. That's a qualitative study and a quantitative study. So this means there are different articles for midwifery students and different articles for nursing students. Do we all get this? If you understand that, can you please raise your hand? There are different articles for nursing students and different articles for midwifery students. All right, thank you. And remember, you need to type your answers in the template that's provided. Okay. So your first question is, what is the aim and significance of the study? Let me bring up your practice article. Now, this is not your actual article. This is not the assessment article. This is a practice article that I believe you might have used in your tubes. Is that right, Rona and Sheeta?
Yeah.
Okay, so I'm sure you're familiar with this article, Living with Chronic Obstructive Pulmonary Disease, the stories of frequent attenders to the emergency department. So I'm going to scroll down now and tell me, where is the aim listed? Have a read of the last paragraph here. So remember, we said the aim is in the introduction. So this is the introduction that we're looking at, the background part of the introduction. Can anybody identify the aim in this last section here? Can you type in the first word of the aim in the chat box? If you identify the aim, type in just the first word. This study seeks to explore, well done. So this study seeks to explore the experiences of living with COPD from the perspective of individuals who present frequently to EDs and their carers. So that's the qualitative article. Let's go on to the quantitative article by Desprez. Again, this is not your assessment article, everyone. This is just the practice one. And let's try to find the aim. Anywhere here? Remember, we said it could be at the end of the introduction section or the background. Type in the start. What's the starting words of the aim? Quick, quick. The purpose of the study. Well done. So that's the aim. The purpose of the study was therefore to investigate the effect of 30% sucrose as pain relief or comfort during measles, mumps, and rubella. Now, how do we write the aim in the template? I'm going to check with Shija and Rona.
Yeah, regarding the aim of the study, what we expect is that like you identify the aim from the study. That's the main point. Because if you try to paraphrase it, the meaning of the aim may change. What the author is actually intending to do may change. Now, for example, if you say to explore, explore is not just understanding. So it's that you identify the aim and you write it down, and you can reference the journal which you are using for the aim. So just for the aim, you do not really paraphrase it. You identify it accurately and write it with reference.
Thank you, Shija. Okay, everyone, that's easy marks for you. You need to identify the aim as it's reported in the study, copy the aim, and paste it in your template with the reference. So, for example, if you're writing the aim from this particular article, then it would be Robinson et al., etc. So you need the reference, you need the writer's name, you need the date, and if it's a direct quote, what else do you need? If it's a direct quote, what else do you need? Please type in the chat box. Number, what number? Diana? Page number, that's right. So please list the page number. So if it's this page, whatever is the page number. I'm just repeating what Shija said. You can copy and paste the aim exactly as is in your article, but you need to reference the aim. So include the writer's name, the year of publication, and the page number. Are we all okay with that? Hands up if you are, please. Do we understand this? All right, thank you.
Shija, I just one thing. If you're asking about page number, the direct quote, etc., then they should be in inverted commas as well.
That's right.
Because it's a direct quote. And I think we just, I'm just thinking there may be a lot of issues with this.
So this is the only place where you will be doing the in-text citations. You're using this article referencing. So other part of this paper, of this assessment, you're not using the citation from the article provided.
Okay, everybody. Only for the aim, you need to put the aim in direct quotation marks because they are direct quotes, and use the author's name, the date of publication, and the page number. Only for the aim, you're going to in-text cite the two articles. Apart from the aim, you're not going to cite the two articles at all. Okay? You're going to use other literature that you find. Right? Okay. So we finished the aim. The next question is, what is the significance of the study? So as you know, significance means what's the importance of the study. So here are some expressions that you can use when you're constructing your sentences. This study is essential as it. So here you need to provide reasons. Why is the study important? So what's the significance of the study means? Provide reasons why the study is important. So another way of expressing it would be research into this area is significant because, or studying about whatever it is you're studying, COPD. So studying about COPD is crucial in terms of this study is highly relevant since it, etc. So let's take a look at your article and try to come up with the significance. So this is the article on COPD. I'm just scrolling through the paper. Usually you'll find the significance in the introduction bit or the background bit. What do you think about this? What does this paper contribute to the wider global clinical community? So it provides insight into the personal perspective of living with COPD, and it also increases awareness about the issues surrounding COPD. Does that sound like why it's important? If you think that sounds like one of the reasons why it's important, can you raise your hands, please? So the question is, why is it important? Thank you. Quite a few have raised your hand. So that is the significance. Now you can scroll through the article and even this part. Given the chronic nature of COPD and the high impact of both the disease and its exacerbations, there is a need to understand the experience of those living with the disease. Okay, so that's another example of the significance. Despite the positive outcomes shown, there is still significant room for improvement in COPD. So that shows that there is a gap in previous research, and therefore this study is important. So when you look through, you might come up with quite a few examples that you could use to answer this question. You might come up with few areas, few aspects why it's important. But remember the word count, you can only use a few aspects, okay? You might come up with a number, but choose the most important. Let's do the same with the quantitative article. So this is the Midwifery article. What is the significance of this study? There is a call for more research on the effect of sweet solution. So there is research, but there is a call for more research. Most of this research has been with children under the age of 1. So there has been previous study on this issue, but it has focused mainly on children under the age of 1. So therefore you need a study that focuses on children above the age of 1. So that's what this particular study is doing. And then again, there is a call for more research, etc. So does this give you an idea what you need to do? You need to read the article, particularly the introduction and background section, and pull out some reasons why this study is important. You might come up with several reasons. From those reasons, please choose the most important because you have a set word count. What's the word count for this, Shija, for this section, aim and...
Yeah, 200 words. So maybe roughly 100 for each part.
Okay, so that's only 100 words for the significance, guys. So remember, just the most important reasons. And how do we write it up? Let's take a look at this example. Have a quick read, everyone. Here the aim has been paraphrased, but you don't have to paraphrase your aim. Okay, you can copy and paste your aim as is. And then you need to write up why the study is significant. As you can see, you're not referencing the article. So let's go back to the article. If you say, despite positive outcomes shown, and you have quite a few references there, you don't have to include all these references. When you refer to the article that you're reviewing, you don't have to reference it at all. The only time you reference the provided articles is in the A. Okay, so even if you're using this part, yes, you need to paraphrase it, but you don't need all these sub-references. Have you all understood that? Please raise your hands if you understand that. Okay, so the first bit is the aim, and then you write about the significance of the study. We don't need any references at all, everybody. It's straight from the paper. Okay, going to the next question. Identify the research design used in the study and was it appropriate for the issue discussed? So let's go back to the Robinson article, which is a quality.
There's a message there for you to repeat your last information.
Okay, so let me bring up the PowerPoint. When you write the aim, okay, all you need to do is copy the aim as a direct quote and put the reference with the page number. Here, the aim is paraphrased, but you don't have to paraphrase the aim. All you need to do is copy and paste the aim. Next, you're going to work on the significance of the study. Why is it important? So you need to go back to the article, and we looked at various examples why it's important. So you might come up with several reasons why the study is important. But because you have only about 100 or 140 or 150 words or so for the significance, you might just write the reasons. That's it. You don't need to include all the sub-citations given in the paper. In other words, we don't need to reference the article provided. That's right, Diana. So you don't reference the article. The two articles provided don't need to be referenced at all. The only time you will reference the article is when you write the aim. Are we all clear now? So we will write the reference for others in the end. Do you mean other references that you choose which are not in the article? Because you need to find some other sources. Is that what you mean, Faiza? Okay, for question 1, let's go back. What's the aim and significance of the study? You don't need any other sources to be included at all. For the aim, you reference the two articles, and that's it. The answer is in the two articles, so you don't need extra sources as supporting literature. Did you get that, Faiza? All right. Now the methods, identify the research design. Let's go back to the article. So now we're doing okay, this is the qualitative article, research design, descriptive qualitative phase of a mixed method study. So that means this study was a mixed method study. There were 2 phases. This one is the descriptive qualitative phase. So that's the research design, descriptive qualitative. So I'm going to take you now to your view side, to your readings and resources. I think this must have expired.
Yeah, one point to add there. So when you look at the research design, you won't be just looking at the abstract, you will look at the design of the paper further down.
Sorry, Shija, I was just focusing on opening this up.
Yeah.
So this is a good book for you to refer to. Is that right, Shija and Rona?
Yes. Yeah.
Okay. So Nursing and Midwifery Research. This is the one by Schneider, Whitehead, etc. And I'm going to chapter 9, I think. Yep, so I'm going to chapter 9, Common Quantitative Methods. So here we see, here are the different research designs in quantitative research, observational, quasi-experimental, and experimental. So what do you think, the article that I just showed you, what do you think that was? It was this one. RCT, which is random control. What do you think it is? Experimental? Okay, let's go under experimental. So I'm scrolling right down. So observational designs. You will need to read through and identify. So you have to read this and then look at your article and try to work out what design is used. Sometimes they use the word experimental or quasi-experimental or whatever. So here we're just going on to experimental designs. An experiment is a scientific investigation that involves observation and data collection according to explicit criteria and protocol. Experimental designs have all three identifying properties: randomization, control, and manipulation. So let's go back to this article. What's RCT? Can you type in the chat box, please? What's RCT? Okay, Rona and Shija, is that right? Randomized controlled trial?
Yeah.
Okay, so that means it is an experimental design, as we read here. So experimental designs have a randomized controlled trial. So this particular study, an experimental design was used because there's evidence of there being a randomized controlled trial. Participants were randomized into two different groups, into the control group and the intervention group. Okay, so now I'm going back to the qualitative ones. So the qualitative one says descriptive qualitative phase. So let's go back to your textbook. And I'm looking at chapter 6, common qualitative methods. And let's take a look at descriptive, because it says there it's a descriptive design. There you go. Qualitative descriptive, blah, 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 is research that relies on pure description. This is distinct from some of the traditional methodologies. And the goal of qualitative descriptive research is to provide a comprehensive summary of events in the everyday terms of those events. So are you getting how you need to work it out? You need to kind of identify what's the design given in the paper. Sometimes the name of the design might not be clearly given. You will need to read up on the different types of quantitative designs or qualitative designs and then match what is in the paper to the design. So remember how we did it? We looked at the paper. It said RCT. Then we went to the article, or we went to your textbook, and we read up on the different designs, and we found that RCT could perhaps be descriptive. Is that right, Rona, Shija?
Yeah, so when you write the design, you identify the design from the paper, and then you come back to the textbook or maybe the other resources, and then you would connect that with the aim and then say, why was this design used? Why was this appropriate to the aim of the study?
Yeah. So going back here. So identify the research design used in the study. So like I showed you, you need to name it clearly and you need to provide some evidence of the design. And I showed you the textbook, parts in the book, etc. that you could use for the design. The next part of the question is, was this design appropriate for the issue discussed? So let's go to, before that, what's the design used? Let's go here. So you will name the design, a quantitative experimental design was used. Go through what's here and pull out some points that you can use to describe the design. So that's the first bit. Look at the article and pull out points that actually explain the design. Okay, so you need to refer to the article about the design. So we're looking at the second bit now. Why was the research design appropriate for the, was the research design appropriate for the issue discussed? Think about the research design. Did the research design provide new insights into the issue? Did it generate important data? Answer might not be explicitly stated in the paper. You will need to read the article, use your knowledge of the research design, and determine if the design was appropriate for the issue discussed, or perhaps it was not appropriate. And yes, for this part, was it appropriate? You must use referenced information. I repeat, the answer might not be in the paper. You need to work it out by thinking about the aim. by thinking about the purpose, the participants, what was done, etc. Rona and Shija, do you want to just touch on this a little bit more?
Yeah, that's right. Like you will identify the research design, expand that more with other references, and then you connect that with the aim to support saying, was it appropriate for the aim of the study?
Thank you, Shija. Like here it says RCT was used. And remember, we looked at the article, and the article said a randomization is often used. So do you think it's a good research design for this study? Can you type in the chat box? We looked at the reading, we looked at what is an experimental design, and it said randomization is most often used. And then we went back to the study, and in the study, RCT is used to randomly assign children into the intervention or the control group. So does this study follow the principles of experimental design? And Diana said yes, because it is random. So you will say this, please don't say yes, okay? So just say this research design is appropriate for the study because the technique of randomization is used to divide children into control group, etc. So that's what I mean. You need to refer to the research design, understand what it is, and then link it to the aim or, you know, what's happening in the study to explain whether it is relevant or not. There is no answer for this in the paper. You need to do your readings and come up with a justification. Does that make sense, everyone? And every time you see a question that says, was it appropriate for the issue discussed? Every time you see that question, you must put in additional references. So you need to put in extra references. Okay, I repeat, was it appropriate? And you're going to see this question quite a few times. Was the method appropriate? Was the design appropriate? When you see the question, was it appropriate? You need to include additional literature.
Now, for example, if you see the study design as phenomenological study, you would relate that to the aim saying phenomenological study design is used to explore the lived experience of people. So this is an appropriate design because this study also explored the lived experience. So phenomenological design was appropriate for the study.
Thanks, Shija. And here are some example expressions. The quasi-experimental design added value to the issue discussed due to, or the descriptive qualitative design was suitable for the issue discussed because. So here are some examples, example expressions that you could use. And when you finish that section, end with a concluding sentence. Therefore, it was best suited to the issue discussed, or hence it was pertinent to the issue discussed. Now here's a sample example. This is how you need to set it out. Just give you a few seconds to read it. Okay, so if you look at the qualitative, a descriptive qualitative research design was used to study the experiences of people with chronic obstructive pulmonary disease who attended the emergency department. Then you can refer to literature. Whitehead, Dilworth, and Higgins report that a qualitative descriptive research design is used when rich data is required from a small sample. So state what design was used, then link to literature to back up that design. In this study, a descriptive research design was used in the second stage of the study to focus on people who attended blah, blah, blah. So name the design that was used, back it up with literature, then go back to the study, link it to the study, and look at the article and pull out some information about the research design from the article. Then you're going to talk about, was it appropriate for the study? The descriptive research design was suitable for the issue discussed because, and you're going to give some referenced information, link to the article and say why it was suitable, why was it appropriate, or if you think it was not appropriate, you could say that as well, but it has to be backed up with literature. Is that right, Shija and Rona?
Yeah.
And all need to be paraphrased. Somebody had asked if it's need to be paraphrased, except the aim. Everything else is to be paraphrased from the paper what you are taking.
Yeah. Thanks, Shija. So similarly, the quantitative study. In this quantitative experimental study, a randomized control trial was used. So name the research design first. Then we're going to back it up with literature. Randomization is mandatory in an experimental design with participants assigned to either an intervention or control group. Then you come back, link it to the study. In the study, 59 children were randomly allocated to an intervention group and 55 to a control group. Parents and children were blinded. And if you want to put in more references, so that's what you do. Shields and Smith state that blinding is an important part of the RCT as it makes the study more accurate. So remember the pattern, state the design, so name the design, back up the design with literature, and then link to the study and explain the design. The second part is, was it appropriate or not? Are we all okay? Can you please raise your hands if you understand what you need to do? All right, you all do. Thank you, everyone. Moving on, discuss the methods. So, discuss the sampling technique, inclusion and exclusion criteria used for the selection of sample in the study. So, let's go to your view site, and I'm taking you to chapter 10 now. So let's take a look at some sampling techniques. Sampling data in quantitative research, chapter 10. So types of samples, so these are the different types of samples: convenience, quota, purposive, etc. Because of lack of time, we're going to look at convenience. You need to look at everything so that you identify the sampling technique correctly. But just to save some time, what's convenience sampling? Convenience sampling uses the most readily accessible and willing persons or objects as study participants. So study participants are already present, and the researcher draws from participants that are already present in a location. So that's convenience sampling. The other one is that we're looking at today is purposive sampling. In the purposive sampling, the researcher's knowledge of the population and its elements are used to handpick cases. So that means the researcher knows exactly who he wants to include in the study. So the researcher has some predetermined inclusion criteria. Okay? So we looked at convenience, we looked at purposive. Just because we're running out of time, let's go back to the article. What's the sampling technique used? Take a look here. So this is the one on children over 1 year. They were given, let's go back to the title. The effect of sucrose as pain relief. So there were two groups. They were randomized into two groups, intervention and control group. And they were 15-month-old children. One group was given sucrose as pain relief. The other group was given just water as pain relief. And this was done when they were being immunized to see which one is effective. So let's go down here and think about the two types of sampling techniques we talked about, convenience and purposive. So I'm just taking you to this section. The population was 136 15-month-old children who had to take MMR vaccine. So now tell me, was that convenience or purposive? So convenience means the participants are already there, and from that group of participants, the researcher just draws on those participants. Purposive means the researcher already has in mind, I need this, this, and this in order to fulfill the aim of my research. So what kind of sampling technique was used in this study? Can you type in the chat box, please? Is it convenience or purposive? The answer is not in the article. Like we did, you need to read up the different sampling techniques and you need to work out what technique was used. Have a go. Is it convenience or purposive? Nobody wants to type in the chat box. Come on, guys. Convenience? Convenience? Okay, convenience means the people were already there. I think this is purposive. What do you think, Shija and Rona? Because they wanted 15-month-old children. But I'm going to check with Shija and Rona. What's the correct answer?
Yeah, so actually it's not the straight answer again here. It's a randomized control trial, and what we do is a random allocation. So it's not, we don't really call this as convenient or purposive because it's a random allocation. So it is still considered as random kind of sampling.
So they don't have to mention the name. Is that right, Shija? They just say random allocation?
Yeah, it is random allocation. So that's what it is important to read, how they have included the sample and then make your critical decision. You can't simply call that as purposive sampling or convenient sampling because a randomized control trial will have a random allocation. That's what they have done in the study.
Thank you, Shija. Let's try to work out from the other article, the Robinson one. So this is the qualitative one. So here, we're looking at people who suffer from COPD and they present often at the ED. There you go. Individuals who presented to EDs 3 or more times within a year and their carer. So it has to be people who had COPD. They should have presented to the ED 3 or more times. So can you work out what kind of sampling technique was used here? Okay. Diana says convenient, Shija and Rona.
See, another safe way of mentioning, if the sampling technique, the technical term is not used in the study, you can write that what were the criteria used to include the sample to the study. And you can say that you have not identified the correct technique, because many of the study would directly tell you it is a convenient sampling, purposive sampling, random sampling, etc. So if they have written so, you can write that this is the convenient sampling or purposive sampling. If not, you can write the criteria used in the study to include the sample to the study.
Yeah. Okay, everyone, I hope you heard what Shija said. If the study names it as convenient sampling, you say a convenient sampling technique was used. If it names it as purposive, then you say a purposive sampling technique was used. Now, as in the case of these two studies, there are no names provided. In that case, you just, according to Shija, you explain what they did. Explain the process of sampling. Is that right, Shija?
Yes.
Okay. And Binju, there's a question. Yes, this is being recorded and will be uploaded to your view site. Okay, everyone, with the sampling question and, was the research design appropriate, etc., it requires a lot of thinking. There is no answer that we can give you. You need to come up with your answers and back it up with literature. The next question is inclusion and exclusion criteria. What's the inclusion and exclusion criteria? Again, the answer is in the paper. So for this question, discuss the sampling technique, inclusion and exclusion criteria. You don't need references at all. the answer is located in the paper. Shija, is that right?
That's right.
Okay. So, what are the inclusion and exclusion criteria used in the study? Let's go back here. This is the Robinson et al. Article. So, inclusion criteria means the participants must have those characteristics. What characteristics? Read this part here. What characteristics should these participants have? Have a quick read. Should they be COPD patients? Yes, Binju, 1500 articles is for both, 1500 words is for both articles together. Yes, Diana, you're right. So inclusion criteria will be people who had COPD, people who attended ED at least 3 times. That's right. Anything else here? What about this? Cognitive status and capacity to consent were assessed by the research nurse. That means they should be in their full senses and they should be able to provide informed consent. So that's the inclusion criteria. Okay, let's go to the other article. What's the inclusion criteria here? Can you type in the chat box? Should they be 15-month-old children? Can you type in the chat box? Yes, 15-month-old children. Anything else? Should they be immunized? So should they have come in for the MMR vaccine? Yes. So that's the inclusion criteria. And you need to read the article and pull out the inclusion criteria. Hi, Mandy. Are you there? I think Mandy has joined us. Mandy, I can't see you. Are you there?
Hi, everyone. Can you see me now?
Oh,
hi.
Welcome. Hello, everyone. I got my life back now. This is Mandy, my savior. Mandy is the PCAL tutor from the Hawkesbury campus. Mandy will be looking at the quantitative article, help you find answers as we run through this PowerPoint. Okay. Mandy, we are up to the question, discuss the sampling technique, inclusion, exclusion criteria. So we've looked at the 2 articles. We found the inclusion criteria. What about, Shija, if there is no exclusion criteria listed in the article? What do we do, Shija?
Yeah. So exclusion criteria is not the opposite of inclusion criteria. It is once we include the sample to the study, and if they possess some other characteristics which make them ineligible to be in the study, that is called exclusion criteria. So if the study is not mentioning it as exclusion criteria, you may write it as the exclusion criteria is not mentioned in the study.
Thank you, Shija. I hope you all heard that, everyone. If there is no exclusion criteria mentioned in the study, like in these 2 articles that we are looking at, there is no mention of exclusion criteria. In that case, you will write a sentence, there is no specific exclusion criteria mentioned in the study. Now, all of you don't write the same sentence, paraphrase that, okay? Otherwise, Turnitin is going to pick it up. But that's approximately what you're going to write. There is no specific exclusion criteria mentioned, highlighted, outlined in the study.
Even if there is no exclusion criteria, you still need to mention those words exclusion criteria in a separate sentence, okay, to say that there isn't any.
Thanks, Mandy. There's a question from Diana, which I'm trying to figure out. We don't reference the textbook at all. Are you referring to this textbook, Diana, the Schneider one? Are you talking about this textbook? Oh, you mean in this question? So this question, let's go back to the question. Discuss the sampling technique, inclusion and exclusion criteria used for the selection of sample in the study. Shija and Rona, I think she means, do they include references for this particular question?
This question is straightforward, and the answer is in the study itself. So you don't have to go back to the textbook, because what's expected is to identify the sampling technique and what was the inclusion and exclusion criteria used for that particular study. So you don't have to reference anything else.
However, if they're going to be defining the technique, if they're going to explain what a convenient sampling is, then they will need to.
Yeah.
And usually that's what they would do.
Yeah.
This is convenient sampling. So what is convenient sampling? They need to identify and define that. And when they define that, that's when they will need to use the reference.
Thank you, Rona and Shija. Moving on now, I'm going to hand over to Mandy.
Hi everyone. So the next question is for methods, and it's 2C, explore the data collection method and its appropriateness to the research design of the study. So we're looking now for data collection. So again, we're going to be in the methodology. And Suzanne, is it easier if you just bring up the
sure.
one for us? Okay. So data collection method and appropriateness. So we want to figure out what is the data collection method. Okay. Now, which one have you got up there now? The
quantitative one.
Great. So if you're looking down here to intervention and data collection here, and have a look through there, it's not always in the one place. You might have to read through the whole intervention and data collection place to see exactly how it's taken out. If you're looking about halfway down, it talks about stopwatch, use of a stopwatch to measure DOC. So that's looking at duration of crying. So that would be how they collected the method for this one. Further down at the bottom of that paragraph, so reading further down, DOC was measured from the time the needle was withdrawn until the child stopped crying. So that's another bit of how it was measured there as well. And then if you go further along even to the end of that paragraph, it gives you a little bit more information and tells you how was it actually measured, and it tells you there that it was measured in seconds and recorded on a form. So you may need to look around that whole section to get all the information needed for the data collection part there. Okay. Now, was it appropriate for the research design of the study? Shija, could I ask you where they're supposed to find that information for appropriateness here? Because it's not actually in the text here. It doesn't tell you this was an appropriate method.
Yeah. So here when you look at the quantitative data collection method, can you go down a bit? Just there in the front, the first page, please.
Yeah.
Okay. So one of the method here mentioned is observation. So you will identify like how do you collect the data? Like the data which they have collected was the duration of crying. The duration of crying was observed. So observation is the method of data collection they used. So you would here say that observation is the best method to collect the data in this study because they have collected the duration of crying.
Would they then need to go down further on the page and sort of find out somewhere in the textbook or in another source then, why is observation a good method for collecting this type of data? So you'd be looking for some positive reasons for why this is a good method to collect data, and then quote your source. So don't forget to pop in your author and your year whenever you use the source to justify why that is a good method.
Thanks, Mandy. So I hope you heard loud and clear what Mandy and Shija said. In this example, the duration of crying was measured. How was that measured? By means of observation. So in the second part of the question, it asks you, was this data collection method appropriate for the study? So yes, you need to refer to referenced information and say, was it appropriate for the study or not? So if you look at this sentence, some clinical researchers are interested in determining how participants behave in certain conditions. And that's what this study did. It observed how babies reacted to sucrose or to water. Okay, so it was an appropriate method for this study. So yes, you need to include reference information. And if you go on to the qualitative study, what was the data collection method? Can you type in the chat box, please? What was the data collection method in the qualitative study? Waiting for you to type in the chat box, folks. Semi-structured interviews, that's right. So that was the data collection method. By means of semi-structured interviews, participants were questioned about their experiences of COPD, how they managed it, etc. So that's the data collection method, and you need to pull out some information from here about the data collection method and explain it, okay, from the article. So some of this information will go in your answer on data collection. Then the next part is, was the data...
Sorry, Susan, there's just a question there on, when we were referring to the text, they asked what chapter was that? And I was just going to say that they need to refer to qualitative and quantitative chapters of that textbook.
Yes, that's right. So was the data collection method appropriate to the study? I'm going back here, quantitative data collection, and as Rona said, there's a qualitative data collection chapter, quantitative data collection chapter. So if we go on to qualitative, where is it? Qualitative data collection. There you go. Oh, that's quantitative. Quantitative. Which one is qualitative? Can anybody find it? Sampling must. No.
I know.
There it is there. The one you passed it.
Yeah.
One below.
7?
Correct.
This is one.
Was it 7? Okay. Yeah. So interviews. Okay. And if you're looking for the answer, was this data collection method appropriate? Go down to the section on interviews. There you go. Interviews may be unstructured, semi-structured, etc. So there you have your clue. What kind of interview was used in the study? It was semi-structured. Therefore, it was a good, an appropriate data collection method, etc. That's just one example, but you need to read through your literature and identify reasons. If you say it's appropriate, we need to support it with appropriate literature. So again, there is no answer in the paper for the question on was it appropriate or not. So repeating, everyone, when you see the word appropriateness, everywhere you see the word appropriateness, you must refer to other sources. The answer is not in the paper. You need to refer to other sources and pull it together with reference to the paper that you're reviewing. Are we all okay with the data collection methods? Can we move on? Hands up if you're okay so far. All right, thank you. So here are some expressions that you might use. Data was collected by means of, or questionnaires were the main source of information. Whatever was employed as a primary method of data collection, gathering data entailed, etc. And we talked about the appropriateness. It might not be in the paper. You need to work it out. Okay, I'm handing over to Mandy again. Can't hear you, Mandy.
Could I share screen now, please, Suzanne?
Yes, sure. I'll stop screen share.
Okay. Okay. Can everyone see the article there? We're looking at the DISPRE practice article here. So now we're looking at results, and we're looking at 3.2. Is that what we're looking at now? Or we're looking at 3?
We're looking at 3A. How was the data analyzed?
How was the data analysed and was it appropriate for the study? Okay. Okay. I've got the results. Can you see anything here for data analysis? We've got your data from here. We're analysed. The children were randomised into 2 independent groups. The intervention group received sucrose and the control group received placebo. Shija, would that be where it's talking about it there?
No, it's under analysis.
Under analysis, sorry.
Statistical analysis of pain behavior as measured by DOC were performed using SPSS.
Sorry, where is that?
That's in page 374.
Oh, under analysis, I'm sorry.
Under analysis.
I'm going forward to results. Okay, so we're looking for how was data analysed. We're still in the methodology section, okay? And we've got a section here on analysis, okay? So using the SPSS.
Yep.
Okay. So do they just get that straight from here, Shija? They just be paraphrasing it straight from here?
Yeah, no, but they also need to mention what were some of the statistics used. Like here they say group means and standard deviations were calculated.
Okay.
They tested whether the control and intervention groups were normally distributed. If that's not written, okay. But they have learned what are some of the descriptive statistics.
Okay.
And they also learned about how do we analyze the data in qualitative methodology. So that part generally is being given under analysis, which as Mandy mentioned, not in the result, but under the methods itself.
So then they would need to go to the textbook as well or another source as well to talk about whether that analysis method is appropriate for this study as well.
Second, yes. So now if you look at maybe say the means and standard deviations were calculated, then they would write this, the measures of central tendency or which they have learned, so they could use that whatever, they are using. Was it appropriate in the study? So they can say like, in order to find the difference in the duration of crying between 2 groups, mean was the best method. Mean was the best statistics used.
Okay. And do they need to get a source for this one as well?
That's right.
Okay. Do you want to take a look and see what you can find on the qualitative, Suzanne?
Yep.
I'll stop sharing.
Thank you. So we're going back to how was the data analyzed. We're looking at the qualitative article. So we look at the section on data analysis. Okay. Can you please type in the chat box, everyone? What's the data analysis method? Okay, you need to be quick. What's the data analysis method in this particular article? I can't see anybody typing. I've pointed you to the data analysis as well. Oh, I'm not sharing screen, is it?
No.
Sorry. Okay, sorry everyone. Here's the data analysis. This is the qualitative article. So what is the data analysis method? Can you type in the chat box, please? Thematic analysis, that's right. So you need to paraphrase some of the information here, like initial codes were generated, they were discussed collectively, etc. So paraphrase some of the information from here. That's how the data was analyzed. And the second bit is, was it appropriate for the study? So for that, you need to go back to literature. So I'm going to chapter 8, qualitative. Analyzing data in qualitative research. and I want to look for thematic analysis. There it is. So we'll go way down. Tell me if I passed it. There you go. This style of analysis treats the data set as a mass of information that can be best understood as a whole rather than breaking it up into small and abstracted sections. So now you can put in some information like that. It has to be referenced. Then you go back to the article. Remember what was done in the article? You can map some of these things. You can match some of these ideas from the source and then map it on to the article. So you're going to find some common links between the article and the source. This is what thematic analysis is. Can you see some elements of thematic analysis in the study that you're reviewing? If you can, then it's appropriate for the study. Does that make sense?
Diana asked the question, can you explain it from the actual article? You'd be doing both. You'd be explaining it from the article, but then also going to a source like the textbook and giving further explanation of whether it was actually appropriate. Suzanne, could you show them where the chapter is for the quantitative, where they can find the data analysis information?
Quantitative.
Analysing data in quantitative. That's chapter 13 you'll be looking at for answering 3.1 for the quantitative part.
So just to repeat, how was the data analyzed? All you need to do is go to the paper and summarize the steps of data analysis as it is outlined in the paper. The second part is, how was the data analysis method appropriate? Remember, when it says appropriate, anywhere you see the word appropriate, you must include supporting literature. So you'll draw on literature, look at the data analysis method, see some elements in the data analysis method. Can you find those elements in the article? So yes, you need to go back to the article, to the actual article. And if you can find those elements, then it's a suitable data analysis method. Does that make sense, everyone? All right.
Shija, are we also looking for what's the benefit of using that type of analysis method from the textbook as well? So any kind of information in the textbook that talks about what are the benefits of using that method?
It may not be just benefit, but where do you use what? Now, maybe for example, like when they say mean they use like when there are what levels of data. They have learned about the different levels of data like nominal, ordinal, etc. So they could write that, mean was calculated because the level of data which they have collected was the ratio level data. So that's how they relate it and write it.
Okay.
It was appropriate.
Okay.
All right, moving on to the next question. What were the main findings or results of the study? So if it's qualitative, you're going to use the word findings. If it's quantitative, you're going to use the word results. So results of the study have established that, or main results demonstrate that, findings underline that, significant findings emerge from the study, they indicate that, etc. So Mandy, do you want to bring up the...
Sure, I'll share my screen now. Can you please stop your? Great, thank you. Okay. Sorry, this is where I thought we were last time. So 3.2, now we're at the results. Okay, so you're coming to your results section now. We're looking at the display one here. Now the results, when I was looking through this paper, I found some of the results in the results section, and I found it explained a bit more also in the discussion section. And I also found it summarized quite neatly in the abstract as well. So there were like 3 different places where I found the results here. Okay. You've got here that 114 were analysed, but then you need to go a bit further to find what were the actual results. And here we've got here, the children cried for an average of 18 seconds in the intervention group and 33 seconds in the control group. Okay, so that's your actual result that you have there. And that's also here, you can see here in the table as well, the results are there as well. In terms of where else I kind of found it as well, Here in the discussion, a strong effect and strong power, and the results are clinically and statistically significant. Can that also be counted as result, Shija?
Yes, they can.
Yeah. But that's actually in the discussion part, but close to the top of the discussion part, okay? Further on in the discussion part, there's a little bit more. I just wanted to ask you, Shija, if this can also be, 25 to 50% concentration seems to be effective, which was confirmed in the present study. Could that also be taken as result as well, even though it's in the discussion part?
They can, like, maybe that's also there in the result, which they are repeating and like supporting it.
Yeah, I had a look and I couldn't find it in the actual result part, which was quite thin.
No, they can only look for the result in the result.
In the results part then. Okay.
So
really that's sort of the only part they sort of had in there. But they did, if you actually go back to the abstract also,
yeah.
for the results here, intervention group was shorter, and then the difference in crying was both statistically and clinically significant. So that was in there as well. Okay, I'll just stop sharing now.
Thank you. I'm going to bring up the Robinson article now, and we go to the findings section. All you need to do is explain the findings as it's indicated in the paper. No supporting literature for the findings and the results. So number one, a sense of grief, loss, and guilt. So if you look here, 5 main themes emerged from the data. Now, the question is, what are the findings? So you're not going to write in your answer 5 main themes emerged. You need to say the main findings are. So what are the main findings? The first one is a sense of grief, loss, and guilt. Don't use this title, but have a read and understand what exactly are they saying here. So,
Susan, you're not sharing.
Oh, I'm sorry.
Yeah.
I'll have to leave everybody now. I'm sorry, I have a student appointment, but thanks for having me, and I'm sure I'll see some of you in individual appointments when you come and bring along your drafts to Hawkesbury campus. Thank you, Shija and Rona.
Bye.
Thank you, Mandy.
Bye.
Thank you.
Are you able to view the article now, ladies? Yep.
Yep, we can.
So here it says 5 main themes emerge from the data. This is under the section on results. 5 main themes emerge from the data. The question is, what are the results? So don't use the word themes, okay? So if it's qualitative, 5 main findings emerge from the data, and then take a look at the first theme and pull out what it is that they are outlining. Participants spoke about frustration that they felt due to the restrictions of COPD limitations. They experienced loss of function and lifestyle. Impact on carers. So what's the impact on carers? Carers felt that they were not able to cope. The end point of self-management. So at a particular point, participants felt, there you go, participants referred to an arbitrary point at which time they knew they were beyond self-management. So that's a main finding. Pull out the main finding from here and write it in your own words. What's the main finding from here? Don't use the title, A Sense of Grief and Loss, but say the main finding was, and explain the main finding. So go down and try to find out the main findings. Pull out the main findings from each section. What about the health experience? There were positive as well as negative health experiences. What do they say about primary health care? So that's how you write your section on findings. No additional literature is required. The answer is in the paper. Are we okay, everyone? Can you raise your hands if you're okay with the findings? All right. Moving to the next one, discuss the limitations and recommendations of the study. Again, you don't need any additional referenced information. The answer is located in the paper. Hence, there could be a section titled Implications or Recommendations. Most often there's a section titled Recommendations. If you're doing limitations or recommendations, they all have to be paraphrased. So let's take a look at the Robinson article. and take a look at some recommendations. Or let's do limitations first. What are the limitations of the study? So limitations means some shortcoming, some negative aspect. So there you go. The first limitation of this study is that participants were located in a single geographical area. So for this one, it's good because it has the side heading limitations, but sometimes you might not have a side heading like that. A further limitation is that there is a potential risk of response bias. So you need to locate the limitations. Let's try to find some recommendations in this study. Okay, so moving along. Here you go, recommendations. Future policy needs to consider this complexity in the development of its programs and provide sufficient resources to enable strategies to assist in embedding interventions, etc. Also, there needs to be improved communication between clinicians in all these levels and the inclusion of both patients and carers. So you need to read the article. Most often, the recommendations are in the conclusion section. Sometimes it could be in the discussion as well. And you need to find the limitations and the recommendations. The other one is this one. So again, let's go to the conclusion. We already found the limitations here. Recommendations. It is therefore recommended that healthcare professionals use sweet tasting solutions for pain relief during needle-related procedures. So that's a recommendation. And also the end of the discussion, the study suggests that the provision of sweet tasting solutions should be implemented as a standard practice during immunization. Would that be considered the recommendation, Sheeta and Rona?
Yes, that is.
Thank you. So everyone, the answer for limitations and recommendation, the answer is in the paper. You don't need any other additional sources, okay? But you need to read and identify the limitations and recommendations, and you need to paraphrase them, write them in your own words. Okay. So as I said before, avoid plagiarism, paraphrase all information from the article. And remember, when you see the word was it appropriate, you must include references. And you don't have to reference the actual 2 articles that you're using. The only time you'll reference the 2 articles is when you copy and paste the aim. That's the only time you're going to reference the articles. All right. I think that's it. Any other final comments, Sheeta and Rona?
No, I think we covered everything. Is there anything?
Okay, there's a question here. No references required. Diana, is that for the limitations and recommendations? If that's your question, yes, there are no references required in the limitations and the recommendations. The answer is in the article. Do we include a reference list at the end of the template? I'll let Sheeta and Rona answer. Yeah.
I think you have a slide, Susan.
Yes.
Yeah.
So yes, everyone, after you type out your responses in the template, at the end of the template, is that right, Sheeta? At the end of the template? you need to include your references. How many references do we have to use for this assessment?
As written in the learning guide, it is minimum 3, and then you can use more than that, but minimum 3. And as Susan had mentioned, all throughout, wherever you find appropriateness, that means you are expected to have some reference there.
And how recent should the references be?
Pardon?
How the references, how recent?
That's a recent last 5 years.
Yeah. So even if the students are using resources, they should be within the last 5 years.
So please, everyone, use current resources published within the last 5 years, and you need to include at least 3 references, or 3 sources, I should say.
Diana, it is the limitation of the study. So we identify the limitation from the study. So you don't need to reference because that's a limitation of that particular study. Maybe as Susan said, like, they have included only people who were attending, or maybe what they have identified as limitation. And it's not the referenced material. It is the limitation which the author identified in the study.
Any other questions, folks? All right. I think...
Susan, you want to say about the referencing of the chapters?
Okay, so if you're looking at the references here, and if you're using your textbook, you're going to be using different chapters from your textbook. And here, there are examples of how to reference a chapter in an edited book. So first you need to put the name of the chapter writer. So that's the chapter writer. Then the year of publication. That's the title of the chapter. Now here you have the name of the editors. So when you put the name of the editors, first you put the initial, followed by the surname. You do the reverse of what you did in the first part. It is strange, but that's how you reference it. I repeat again, so the first few writers, or the first writer that appears here is the chapter writer. Then you have the title of the chapter, followed by the names of the editors. So EDS is the editors. And this, how to write your nursing dissertation, that's the title of the book. And then pages refer to the pages of the chapter that you're using. And then publisher, or place of publication, followed by publisher. So here the Whitehead one is referenced here for you. Shields and Smith, that's taken from your textbook. Please follow the same format. Do we put A, B, C, etc. when it's different chapters? I know they do that for in-text citation. It depends, but that's a whole area which involves a lot of explanation. Refer to the APA guide and follow exactly what the APA guide says. You usually put ABC when you have, that's right, when you have the same year, different publications by the same author in the same year. But I'm not going to confuse everybody else, Diana. You appear to know what you're talking about. So please refer to the APA guide and follow it. Yes. Any further points to add, Rona and Shija?
No, unless they have something more to clarify.
I think you've covered everything, and the recording will be on Views.
Yes.
So you can access that if they need any further clarification.
Right, then we leave it at that. Thank you, everyone. Yes, you have another webinar tomorrow for Liverpool students. Is that right?
Yes.
All right. Good luck with the assignment, everyone. Yes, it's going to cover the same topic. Thank you, Rona. Thank you so much for your time, Shija and Rona.
Thank you.
Thank you, Susan.